I have just started the recording. So welcome to the Center of Excellence for Health. We are here in day 2 of Allied Health Week. We are extremely excited about our day 2 and the presenters. We had a wonderful presentation this morning, and this afternoon is going to be full of fun. So I am Deneen Diamond. I'm the lead for the Center of Excellence for Health. And the purpose of Allied Health Week is to get our students super excited about the opportunities in allied health and the health sector, and hopefully help, familiarize them with some of the opportunities that they haven't heard about. So without further ado, caring for the whole person means caring for the body, mind, and spirit. Clinical spiritual care practitioners are the members of the healthcare team who are specially trained to support patients and families when their spirit is distressed and when they are experiencing pain in the core of their being. Spirituality refers to the way in which a person finds meaning and purpose, and the way that they relate to themselves, to others, to nature, and to their source of meaning. Spirituality is not the same as religion. It may be found in religion, but it does not need to be. So Pam Driedger is a certified clinician spiritual care practitioner and a certified supervisor educator for clinical psychospiritual education and the Canadian Association for Spiritual Care. And that is a mouthful. So without further ado, I'm going to turn it over to Pam. And once again, we are so grateful and thankful to have Pam here with us this afternoon.
Thank you very much. So the title I have here is Clinical Spiritual Care Practitioners, Who We Are and What We Do. I was tempted after the colon to put just Clinical Spiritual Care Practitioners, Who Knew? Because we are probably the profession that the highest percentage of people don't even know we exist in the hospital. So the objectives for today: to define spirituality, to understand what spiritual health is and why it matters, to have some idea of what we mean when we talk about spiritual distress, to understand the role of clinical spiritual care practitioners in promoting spiritual health and responding to spiritual distress, to know what's needed to become a spiritual care practitioner, and to understand that being a clinical spiritual care practitioner is in fact one of the best jobs in the hospital. So some questions. If there were a whole lot of people here, I'd ask you to introduce yourself so I knew who you were. But I'm going to ask the questions anyway. So who are you? Where are you? What's one thing that brings you joy? What's one thing that puzzles you? And those are good questions for introducing ourselves in a group. But they're also basic spiritual care questions. Those are the sorts of things that spiritual care practitioners talk with patients about. So, again, I'm a certified clinical spiritual care practitioner and a certified supervisor educator in clinical psychospiritual care education. So the question is, what do you think I do? And I wish that I could hear your answers, because I'd love to know what people think that I do. I know that my son, who's now in his 20s, said, yeah, that question, what does your mother do, was the bane of my existence growing up, because people would ask me and I'd have a really hard time answering. So clinical spiritual care. First and foremost, it's care that's patient-centered. It's not faith-centered. So if a person is religious, spiritual care can be religious. But if a person doesn't want anything to do with religion, then spiritual care doesn't have anything to do with religion. It really is about what people believe and value and how they find meaning. And spiritual care, clinical spiritual care, is care that would be appropriate for any individual, regardless of their belief system or philosophical perspective. And I'm going to play we have a few 90-second videos that are on the Horizon Health Network website that explain spiritual care and spirituality. I'm going to play one of them. Unfortunately, when I pasted it in here, you didn't get a nice picture that goes with it. But So it looks blank in here, but it isn't.
And we can't hear anything. Is there anything on the
Whoops.
volume?
Sorry. You know
That's
what?
okay.
I bet when okay, I'm going to have to stop. That means I have to stop sharing for a second. It means I forgot to click something. Is that okay?
No worries.
Okay.
Take your time.
Sorry. Oh, I didn't mean. Okay. Let me go back to Teams.
We have all been there, and half of the time my PowerPoint and videos don't work. So you're ahead of me.
Okay. Stop sharing. Share. I know what I did. I forgot to click. No. PowerPoint. No. Okay, there's a piece that's missing. Now I'm sharing again. Oh, good grief. Stop sharing. Share.
We can always add in the videos at the end of the presentation when we link it up as well.
Okay, PowerPoint. What it's not giving me, okay, I'll do a different approach. No, it's not giving me the option to share volume. So, which it normally does. So never mind. What I'm going to do, we can skip that. I'm going to talk about this anyway.
Okay.
So we're just going to skip the video. I apologize for that.
No worries.
Okay. So if you're going to talk about clinical spiritual care, you have to start with the question of what is spirituality? So I wonder what it is that you think of when you think of spirituality. And I already told you not religion, but so I wonder what else comes up. The definition that we use in Horizon is a composite definition from lots of different research sources. So spirit can be defined as a person's unique connection to self, to others, to nature, and to God for anyone who believes in God, and for anyone who doesn't believe in God, then to whatever their source of greater purpose is. And one of the reasons we use this definition is because it very, very nicely spells out song. So spirituality can be understood as a person's expression of their unique song. When we talk about spirituality, we're talking about what people do, what they believe, what they ponder and think about, what they practice in their lives to cope with all the things that they can't control. So there are plenty of things in life that we can control, but there are even more that we can't control. And for each of us, it's our spirituality that is the way we deal with the things that impact us that we have no control over. Another definition of spirituality is that spirituality is what we do with our vulnerability, with our human limitations. There are 4 basic spiritual questions that really shape our understanding of disease and health. They are, who am I? Where do I come from? Why am I here? Or what are my responsibilities? Which are just 2 different ways of asking the same question. And where am I going? And you might look at those questions and think, well, what do they have to do with health? But they have a whole lot to do with how we understand what's happening to us and what our next steps should be when we're facing illness, when we're facing disease, when we're facing injury or a decline in our ability to do things we used to do. Clinical spiritual care practitioners don't give people answers. I can't tell you or anybody else who you are. I can tell you your name, but I can't tell you who you really are. I can't tell you where you come from. I might be able to tell you where you were born, But how you tell your story of where you come from, that varies. I can't tell you that. And I certainly can't tell you what your purpose is in the world or where you're heading. But what I can do is I can help you really listen to yourself and help you work on finding your own answers and finding the sense of peace and well-being that comes from being rooted in your own answers. So the two main things that clinical spiritual care practitioners do are we promote spiritual health and we respond to spiritual distress. When we talk about spiritual health, we're talking about strengthening the connections that enable us to orient ourselves in the chaos of life. So strengthening those connections to yourself, to others, whoever others may be for you, strengthening your connection to nature or to the natural order of things, and strengthening your connection to whatever gives meaning to your life and purpose to your life and order to your life. And when those connections are stronger, we can find our way through the chaos. Sometimes spiritual care can be thought of as helping you connect to your anchor point. So if any of you live in New Brunswick, if any of you have spent time on boats, you know that when a boat is anchored, the anchor helps keep the boat pointing into the wind during a storm so that the boat won't fill with water. And our spirituality basically does the same thing. It helps keep us pointing into or towards the things that give us stability so that all of the chaos of life doesn't overwhelm us. To be spiritually healthy means to have a belief system, to have a worldview, to have a way of explaining your place in the world that helps you respond to the fundamental questions of human existence. So some of those fundamental questions are, what's the meaning of life? What's the purpose of my life? What's success? What's failure? Why do bad things happen? What is love? How do I know what's right and what's wrong? What's forgiveness? What gives hope? Who's in control of my life? Where do I belong? All of those questions are important to all people. All of those questions, everyone needs to find an answer for themselves to each of those questions. So they are fundamental to human well-being, but we don't all agree on what the right answers are. For most of the other areas of health, there is some sense of here are the better ways to do it. When it comes to spiritual well-being, we absolutely don't all agree, and trying to force everyone in the same path makes things worse. To be spiritually healthy is to be comfortable with your belief system, your worldview, the answers that you find to all of those questions, and to be comfortable with your place within that worldview. So some people have a really clear spiritual worldview or really clear worldview, but they're not comfortable in it. There are people who believe that certain things are required to be a good person, and they aren't able to do those things. Certain things are necessary to be a valuable person, and they aren't able to do those things. A lot of people, when they come into the hospital, have always believed that bad things only happen to bad people. That if they do everything that they are supposed to do, really bad things won't happen to them. And suddenly they come into the hospital and bad things have happened. And now their worldview says, oh, it must be because of something they did. And that they're not okay with their place in that world because they can't find anything that they did wrong. So they need to do one of two things. They need to either figure out what they did wrong and how they can fix it, or more often, they need to change their worldview so that there's a space for them to be a good person, even with the terrible things that have happened. To be spiritually healthy is also to have a clear connection between your belief system, your worldview, and the way you live your life. So a lot of people have a set of very clear beliefs, things that I need to do to be good, to be successful, to be happy. And then they live their life another way. And there's a constant war within them. And they can't find a sense of calm and well-being. So spiritual health is about bringing what we believe and how we live together. And sometimes it's how we live that has to change, and sometimes it's what we believe that has to change. And it's never the job of a spiritual care practitioner to help you to tell you which of those two things you need to change, only to point out that there's a disconnect and to help you begin to sort your way through that. Spiritual health can contribute to mental and physical health by reducing stress and anxiety. So there's an enormous volume of research that's been done recently that shows that people, or that's been done over the past 20 years, that shows that people who have high levels of spiritual well-being have significantly better mental health. They also have significantly better physical health. In fact, a healthy spirituality has been determined to be as good for your longevity, for how long you live, as not smoking. So that's a research study recently published in the Journal of the American Medical Association. So spiritual health also enhances your ability to cope with setbacks and manage pain. Spiritual health can give you a reason to do hard work that's necessary to live in recovery, whether that's the hard work that's necessary to recover from a physical illness, to recover from an accident, or to recover from an addiction or a mental illness. And spiritual health can help you find hope, meaning, and quality of life in the midst of the most difficult circumstances. For people who are dealing with significant physical health issues, significant mental health issues, or both, they can still have they can still have spiritual health. And when they have spiritual health, they can still have a sense that life is good, that no matter what happens to them, no matter what they're going through, their life is good. Spiritual health can be compromised by both illness and addictions when a person loses their connection to the people or things that gave meaning, hope, or purpose. Spiritual health is compromised when a person can no longer live in ways that reflects their beliefs and values, when they can no longer accept the answers that they accepted in the past, or when the illness or addiction raises questions that the belief system doesn't answer, or when the things you need to do to improve your health conflict with your beliefs. One of the things that can sometimes happen is people can come from a belief system that says they should be able, if they just think positively, they should be able to make certain things happen. And their doctors are telling them, no, you really are going to have to take these medications. If you don't take these medications, things will keep getting worse. Maybe they believe that to be faithful to God as they understand God means not taking medications. And again, they may keep getting sicker. Maybe the thing that they need to do is they need a blood transfusion. And they come from a faith tradition that says they can't receive a blood transfusion, but they actually want to receive the transfusion. So then they have to figure out what the balance is. So do they stay with the belief system in the community, or do they choose differently? And that's not easy. And it's not straightforward. It can be very simple for people who are outside of a belief system to think, oh, I know what I do. But it's not easy when you're in a belief system to know what the right choice is all the time. So when a person's spiritual health is compromised, they experience what we call spiritual distress. And on the screen, you see a lot of the signs of spiritual distress. So hopelessness, fear, resentment, loneliness, blaming, powerlessness, grief, shame. You can read all the rest of them. That first group are some of the ones that hit people hardest. Shame in particular, because shame is the sense of not being good enough. And that's basically always a sign of spiritual distress. When it's spiritual distress, it's linked in with a belief system. It's linked in with an understanding of the world. It's linked in with how we understand our relationship with other people. And so it's not particularly easy to treat if we don't pay attention to what gives meaning, what gives purpose, and how you answer those fundamental questions. One of the things we know about pain, whether it's physical pain or emotional pain or spiritual pain, also called existential pain, is that in order to successfully process pain, we need to experience the negative thoughts and emotions. We need to experience the negative feelings while maintaining meaningful connections. So a big part of the work of a clinical spiritual care practitioner is to stay with someone in their pain, not to distract them from their pain, not to try to get them to think about something else, but to hold a space where they can feel the pain and feel the difficult emotions and also feel a strong sense of connection with someone else so that they can begin to process the pain. For lots of people, they have lots of supports around them. They have family, they have friends, but their family and friends hurt when they hurt. And their family and friends don't want them to feel pain. So they try to talk them out of pain, and that doesn't work. And also the people who are in pain try to protect their family and friends from the pain. And so sometimes they need to talk to a stranger whose job isn't to fix anything, whose job isn't to change anything, but whose job is to stay with them in the pain so they can begin to process it. The Canadian Association for Spiritual Care describes the work of clinical spiritual care as respecting the body, engaging the mind, embracing the emotions, supporting the human spirit. You really could start anywhere in that cycle, because spiritual care, clinical spiritual care, pays attention to the interrelationship between body, mind, emotions, and spirit, and the way each of them is influencing all of the others. And when we're staying with people and helping them to really pay attention to themselves, we're helping them to pay attention to what they're physically experiencing in their body, what they're thinking, what the emotions are that are present, and then how all of that is coming together in their meaning system, how they're working with it. Back up to the space before. We do this in all kinds of different ways. So there are lots of different practices that are part of how spiritual care practitioners do these things. So we help people pay attention to what they feel in their body. If you're talking about grief, if you're talking about anger, if you're talking about frustration, we might ask you, where are you feeling that in your body right now? and really help you work with that. We might help you pay attention to the difference between the thoughts that you're thinking and truth. Just because I think something doesn't make it true. Just because I think that nothing I'm experiencing right now will change doesn't make it true. It's a thought. Help you embrace the emotions, whatever they are. There are a lot of emotions people don't like to feel. And spiritual care practitioners really help people stay with the emotions that they feel. So we attune to the body. We help people with self-regulation. We help people with visualization. We do mindfulness practices, which have become so popular, are actually spiritual practices. They all started in spiritual traditions, and every spiritual tradition has a form of mindfulness. So that's one of the things that we have an expertise in and we teach. We help people find the meaning in their own life story and share that meaning with other people. We do a lot of legacy work with people. We do a lot of work in processing grief. Grief is not something that can be fixed. It's something we need to learn to walk through. So those are just some of the kinds of things that spiritual care practitioners do. How do you become a clinical spiritual care practitioner? So the first thing is you need a master's degree. So all clinical spiritual care practitioners have a master's degree. We have master's degrees in a variety of different fields. So some people have a master's of divinity. That's the traditional training for ordination within a faith tradition. Most often it's within a Christian tradition, but it doesn't have to be. It's just there are only a couple of other traditions that call it a master's of divinity when it's not Christian. But a master's in divinity or a master's in Judaism, rabbinic studies, a master's in Buddhist studies. You can have a master's in spiritual care. You can have a master's in religious studies. You can have a master's in arts and theology, or you can have a master's in a related field. You could have a master's in psychology, or a master's in counseling, or a master's in social work, with then some specialized coursework in spirituality. So the master's degree can come in a lot of places, but all certified practitioners do have a master's degree. Within that master's degree, regardless of what type of master's it is, there's some basic core pieces of theoretical knowledge that we all have to have. We have to demonstrate through successful completion of either courses or postgraduate work. So we need to have an in-depth knowledge of at least one spiritual tradition. It doesn't matter what spiritual tradition that is, but we need to understand how history and culture and belief systems and sacred writings, if it's a tradition that has sacred writings, and the community value system, how all of these things together shape choices and shape understanding of what's going on. If we paid attention to those things in one tradition, then we can understand how they can also impact people coming from a completely different tradition. The other reason you have to learn one tradition well is so that you know how to get your own tradition out of the way. So we often, if we haven't studied our culture, our history, our belief system, we often think of it as just a given that applies to everybody without knowing how to get it out of the way when talking to someone whose belief system is very different. We also need a theoretical knowledge of world religions, spiritualities, and cultural traditions that are different from our own. So a broad understanding of different world religions and their values, beliefs, and practices. Our current certification requirements require that we have a theoretical knowledge of the experience of Indigenous peoples in Canada, and that we know about the findings and recommendations of the Truth and Reconciliation Commission. We have to have a theoretical knowledge of psychological and personality theories, of various approaches to psychotherapy, and of research methods. So regardless of what kind of master's you have to be able to demonstrate that you have all of this kind of knowledge. either after your master's degree, or for some people, they do this alongside their master's degree. We need clinical psychospiritual education. So on average, certified practitioners have 4 modules. Each module is 400 hours. So on average, certified spiritual care practitioners have 1,600 hours of supervised clinical education. When they don't have that many hours, it usually means that they had clinical education in another profession. So maybe they came in from a profession in psychology, or maybe they came in from nursing, or maybe they came in from social work, and they have clinical experience, so they don't need quite as much supervised clinical experience in psychospiritual clinical practice. So that 400 hours is always divided into 200 hours of intensive small group work and group supervision, and 200 hours of direct clinical practice. There are 3 different levels of, so I said normally you'd have 4, the average is 4 modules. There are 3 different levels at which those modules occur. So the first level is called the foundational level. And the focus of the foundational level is on intrapersonal awareness and attunement. So intrapersonal, if you're not familiar with the word, means what's going on inside yourself. So the first clinical unit for almost everyone focuses on really knowing yourself well, recognizing how you're reacting to other people, recognizing what's going on inside yourself in terms of your own emotions, in terms of your own physical reactions to things, in terms of the way you're thinking about things and the way your thoughts are affecting what you do and don't talk with other people about. So in terms of intrapersonal awareness, we spend a lot of time developing skills in mindfulness, in self-compassion, recognizing our own, the family systems we came out of and how they've shaped us, and working with internal family systems. If you've ever seen the movie Inside Out, that's really what internal family systems is about. It's about how all the parts of us work together inside of us. We focus on how my way of being impacts other people. And we develop our ability to really stay present to another person, to really stay with them and be fully there, not just pretending to listen or looking like we're listening. One of the core principles around why we start with a focus on intrapersonal awareness is, since our job is to stay with people in pain so that they can process that pain, it's an understanding that we can only go as deep with someone else as we've gone with ourselves. We can't stay with someone else in their distress about not knowing, in their fear of dying, in their fear of their child dying, in their fear of never walking again, if we have never faced what it means to come to terms with our own limitations, with our own mortality, with the possibility that everything we care about could be lost tomorrow. So our second level is called an integrative level, or integrative modules, and those focus on our interpersonal skills. So that's where we really shift to the clinical skills, and the emphasis is on developing the clinical skills, developing our ability to do in-depth spiritual assessments. So again, a huge study that was published this past summer in the Journal of the American Medical Association looked at the importance of spirituality in serious illness, and has recommended that spiritual assessment be considered routine for any patient with serious illness, which means that every person who's facing a serious illness should be assessed for their spiritual well-being, for spiritual distress, for spiritual resources. So clinical spiritual care practitioners are the specialist in this. And these integrative levels are where we really learn how to do an in-depth spiritual assessment and how to develop a spiritual care plan, how to help cultivate spiritual well-being. It's where we learn how to use all that we learned about ourselves effectively in working with someone else, how to draw on my own strengths to work with someone else. The focus of this level is on helping the other person, the client, to tap into their own inner wisdom and draw on their own spiritual resources to change what can be changed and to cope well with what can't be changed. And then our last level of I guess you'd call it our last level of clinical practice or clinical learning is we call our contextual modules. And those focus on providing care in the context of systems and helping others within the system pay attention to the spiritual aspects of well-being. So in our last modules, we really focus on leadership skills, on conflict resolution skills, and on ethics. Clinical spiritual care practitioners are often involved in discussions when there's a disagreement about what's right and wrong. And when patients or families are struggling with choices, or when staff is struggling with choices that patients and families are making. Once we've completed the master's and however many units of clinical practice, or not supervised clinical practice, it's deemed that we need, we get tested at all different points. Then we need an additional 1,000 hours of mentored practice. So where we're simply working on our own as clinical spiritual care practitioners, but someone is overseeing what we're doing. And once we've done that, we go through a certification process. So we have to write a series of papers. We have to engage in a patient encounter. That could be a written encounter where we do an in-depth case presentation on someone we've met, or it could be a live encounter where we are, where it's I guess you call it a volunteer patient, and someone else watches how we are providing care and assesses their specific standards we're assessed on. And then there's assessment before a committee. So we've written the papers, people have watched us or read about how we interact with a specific client with a specific case. And then we go through an interview process. I guess it's similar to a thesis defense in some ways, where we explain how we pull all the pieces together. And assuming we pass, we're certified. So I said the last thing was why you'd know, or helping you to understand that clinical spiritual care is really a fantastic job. So clinical spiritual care practitioners are invited into the sacred spaces, the sacred spaces and stories that make each person unique, where people talk about things that they may never have talked about with anyone else. They may never have even thought about themselves. Where you walk with people when suddenly they're making sense out of things that have never made sense. They're finding hope where they thought there was no hope. They're finding possibility where they thought there was no possibility. A lot of time in spiritual care is spent with people who are dying or approaching the end of life. And people often say, it must be so distressing. It must be so depressing. And patients will often say that to me when they've been talking about their fears of dying or about their grief and their loss. But one of the things, usually at the point at which they say this must be so hard to do, is right about the time when they're saying, wow, talking about this has really helped. And one of the things I can always say to people is, it's true that sometimes it's really hard work. It's true that sometimes there's a tremendous amount of sadness. And you have to hold a lot of sadness for a lot of people. But it's also true that spiritual care allows you to see firsthand on a regular basis the incredible resilience that people have, the incredible power of love and connection, that you see how people facing what looks impossible make it through, and not just scrape by, but make it through with a sense of joy and wellness. And that is an incredible thing to share with someone else. So I don't know if there's anyone here now who would have any questions, but that's all I have to say about clinical spiritual care, but I'm happy to answer any questions that anyone might have.
Thank you so, so much, Pam. That was absolutely amazing. And I think we all learned a lot about a profession that we may not even know existed prior to the presentation. So I know there are students out there. So if you have any questions, certainly you can type them in the chat, or you can pipe up and cut me off if you'd like. I certainly, while you're thinking about it, maybe I have a question, and you kind of hit on it at the end of your presentation around how difficult it is to be a spiritual care practitioner. But I guess one of my questions that I always ask, you spoke about why you do your job and how you do your job. So what would you say would be the biggest highlight of your job? And again, you spoke about being with the people and being intentional and really present, which is so lovely, especially in today's world. So I guess my question is the biggest challenge, and also probably what you are most excited about.
I think the biggest challenge is truly staying fully present all the time. That having to remind myself, and it doesn't matter how long I've been doing it, there are times when I start to realize I'm not thinking about the other person. I missed something that they said, and I need to intentionally bring myself back in and stay, especially when people are repeating something they've said before. But when
Right.
people repeat something that they've said before, it's not exactly the same. It's what they're experiencing in the present moment is different than what it was the last time they said it. And so for me, the biggest challenge is always remembering that every single moment is brand new and constantly bringing myself back to that. And the biggest reward, so I genuinely believe that many of the things we consider crises in our world, when we say that we've got all kinds of things that are going wrong, whether it's the environment, whether it's the increase in anxiety and mental illness and suicidality, whether it's the enormous increase that's happened over the last little while in violence. I actually think that all of those things are actually spiritual health crises. That they come because many individuals and many communities have lost their sense of meaning and purpose. And so I genuinely believe that spiritual care changes individual lives and can change the world.
Oh, I just got tingles thinking about that. That's lovely. I do see that our favorite teacher in the province, Miss Kraft, has her hand up.
Thank you for that. Thank you, Pam, for everything you shared today. We do have kind of a two-part question. Just curious about in your workplace, do you work primarily independently, or do you work as part of a team? And also, what does your week or your days look like? Are you one-on-one with your clients, or are you planning programs and courses? And we're kind of curious about what that looks like.
Okay. So in New Brunswick, we do not have nearly as many spiritual care practitioners as sort of standard best practice would recommend. So the average across North America is one clinical practitioner per 100 patients. We don't have that many here. So our teams are very small within spiritual care itself. We only have 2 practitioners at the Moncton Hospital right now. And that's St. John Regional Hospital has like 1 full-time and 1 part-time. Fredericton the same. Miramichi has 1 full-time. We don't have as many as we should. So our spiritual care teams are small. We work as part of and that is something we are actually working on within New Brunswick to increase the numbers. We work within the teams on units. So we participate in interdisciplinary rounds, and we work with other members of the interdisciplinary team, and we receive our referrals from other members of the interdisciplinary team who will say, this patient is really struggling with existential distress. Questions of why me, why this, why now, what's the point? We also, within the team, we also are the ones who will often ask the questions of, well, could there be an issue here with their belief system? Is this conflict? I would say that any time we call a patient non-compliant, anytime a patient isn't doing what the hospital team thinks they should be doing, there's a spiritual issue, because it means there's a values conflict. And so we often get called in for that. So that's the second part. A third part was, what does my day look like? So my day, because I manage the department and I'm a practitioner and I'm also a supervisor educator, my day, it depends on whether I'm teaching or not. But when I'm working with patients, it's usually either one-on-one with the patient or I'm with the patient and family together. It's quite common for spiritual care to work with patients and families together. I will also occasionally meet with families only, because I provide support for families in how do they deal with their own spiritual distress in order to support their loved one. I do, because my role I have an educating role, so I also do presentations for teams on spiritual well-being. I work with the the PACT team, which is for children who are facing terminal illnesses. And so I've done some work in helping with that. I do some of the training for learning essentials in palliative care, because there's a spiritual component to that. I get to do all kinds of different things. So.
Awesome.
Thank you so much. Sounds like your staffing problems are similar to the guidance counselors in the province.
Yeah.
Thank you. Thank you very much.
I was just about to say the exact same thing. I think that's probably what a lot of people are struggling with all over our province in every career. So certainly, if there's any other questions, please don't hesitate to pipe up. But I want to say thank you so much for presenting today, Pam, but also thank you for the work that you do, because I think that a lot of the time we get caught up in what's not being done. And obviously you are doing a lot of amazing things in different ways. And I feel blessed to know more about your profession, and I hope the students do too. And I know that we certainly have an advocate that's working towards spiritual care and the importance of spiritual care for everybody. So from the Center of Excellence for Health, I want to say thank you so much. And if there isn't any other questions, I'll probably stop the recording right now. But thank you again from Horizon and from the Center of Excellence for Health. And please feel free to stay on if you have additional questions.
Thank you.